company so that we are ensuring that our patients and our employees are operating in a safe environment. We've gone to great lengths to ensure that there's full compliance. Any of the patient-facing procedures that are done are being done so with appropriate shielding, mask, of course, PPE. Implemented some new technology just to ensure that we have what we've called virtual waiting rooms, social distancing in the waiting rooms, of course, but the capability of a patient to text from a car, text the night before, confirming appointments, similar to restaurants where you get the little alert button when the appointment's ready. We do the same thing just using our radar platform, which is a critical messaging system. So several innovative ways to reach out that will probably be retained post-COVID. But in a nutshell, it's how do we continue to provide services so that our referring docs and our patients have access. They have access to a safe environment, and they have access and a level of comfort that we are a really good outpatient alternative to ending up with care in the hospitals, which for most of the states we're in have had a problem with capacity. And, last thing we need is outpatient imaging going to a hospital at this point. So lots of activities in the last 6 weeks, but in a nutshell, it all comes down to compliance and ensuring that our facilities are doing what we need to do to ensure safety.
How about you, Wes?
So our business was impacted quite severely. Pathology, we saw about a 70% decrease over the last few weeks in our business lines. Obviously, with our employees, pathology is kind of difficult to do from home. So we did have to provide a safe environment, social distancing, gloves, masks, PPE to make sure that everybody was protected, which we did do and have continued to do. The biggest challenge is how do we survive in an environment like this? And certainly the government made it a little easier with furloughs in that, many people have been able to, in fact, make more money staying at home than working. And we wanted to be cognizant of that and understanding. Obviously, at first, your thoughts are, do we reduce hours so that everybody's got some hours and somebody's got a paycheck? How do we keep people employed? What do we do? We've been doing all of the above, but it became obvious that in certain circumstances, furloughs were better for certain people. So we've tried to accommodate the best we can so that we can be as well prepared as possible to come out of this and deliver appropriate service to the patients and to the clients when it does occur. We are starting to see that uptick. My big markets, North Carolina, South Carolina, Georgia, and Florida, Florida being one of the largest, we have seen consistent increases over the last 2 weeks. My Tuesday 2 weeks ago, we were at about 30% of our normal numbers. The Tuesday after that, we were up 25%. This Tuesday, we were up another 30%. So every week it's continued to grow. We're seeing significant gains. We feel like we're coming out. It's not completely there yet. The concern is what is going to be the new normal? And we're not quite sure whether we're going to get back to 100% on a normal basis without growth, because we do understand that physicians will be seeing their patients in a different way, calling patients from the car, creating social distance in the office and protection so that they feel comfortable coming in. And that's really what we're trying to anticipate right now.
So I have a question. What's the, for both of you actually, what's the psyche of the patients? Is there fear to go into the physician groups? Is there fear to come in and get blood drawn? Is there fear that, the imaging facilities, Charlie, they can catch the COVID there? Are you getting any feedback on those fronts?
Well, no, not specifically, but I think you can take away from the fact that a lot of patients are just following state orders, which is only essential care is to be provided. So, many of the normal or traditional referral channels are shut down. So some of the patients actually are walking in. I just got off a call before this one where we've got patients just walking in, not even scheduling up in New York, which is unheard of, right? But
Yeah.
We're not getting people calling and saying, I'm afraid to come in. What are you guys doing to ensure a safe environment? We are promoting that. It's all over websites. We've sent flyers out to all of the insurance companies, referring offices, so that they know exactly what's being done to alleviate any concerns that they may have. But I'm not getting any secondary feedback from patients where they don't want to come in. On a side note, I can tell you, just as many of us as we talk to our family members, we also hear the second and third hand responses, which is, hey, yeah, the referring office still isn't open. I just got a call from my dentist. I had some elective surgery that has to be done, and they're like, we're opening up May 11th. Let us know. And that's, of course, in response to state of Virginia releasing the stay-at-home order for some essential practices. So dental offices are starting to reach out. I think you'll see more referring offices open up. But I kind of like Wes's comment about who knows what the new norm's going to look like. We will continue to reach out. We will continue to ensure through normal referral channels that everyone understands from a safety perspective, we're here, we're open, and we're doing everything that's, possible to ensure patients don't have concerns about coming in when they get care.
Yeah, I think that's totally accurate. We've seen the same thing. There's a significant amount of telemedicine going on, which, let's face it, if we know that 80% of the population isn't typically using as much of the healthcare dollar, and it's the 20% that does, 80% of the population is going to appreciate that telemedicine. The problem with telemedicine is if you do need a procedure, if you do need a biopsy, you're going to have to go back into the office to do it, so it's a second visit to do so. And what we're seeing from a lot of our doctors right now is they've been using the telemedicine, but a lot of these procedures, a lot of these biopsies that need to occur have to start happening. And we're getting the calls from our doctors that they are opening their offices back up because they do have patients that need biopsies and they need follow-up, which means they do need to come into the office. And to that point, it's been very interesting. Florida's been fairly open. The doctors have stayed open, but they haven't had many people coming in because of the orders from the government, the stay-at-home orders. That's kept them away more and kept them more to telemedicine. And we do a good deal of work in Miami. And Miami being a hot spot, we've seen more of a significant drop because of that. So I think people are heeding the instructions of the government. They're using the telemedicine. I think the majority of the population is going to appreciate the telemedicine. Obviously, it's a little more challenging if you do have to have a procedure because it's going to require a follow-up. But we are seeing people now, they're kicking back in. We're getting calls from doctors. They're going to be in the office. These procedures need to happen. I do know, for instance, it's not a patient, but it's a friend that has prostate cancer. He's been waiting to go in for surgery, and it had been put off because of the pandemic. And so it's now finally getting rescheduled. And you think of something as serious as prostate cancer, it's not something you want to put off. So we're starting to see these things come full circle now, and it's getting back to some normalcy, which is good to see. But again, what will that mean in the future? I don't know. I don't know that doctors will be able to see the same number of patients they did in the past because of the challenges of keeping everyone safe.
Yeah, I'll add to that, Wes. I don't know if the labs are experiencing this, but I can tell you that the turn times have increased for appointments. So what may have taken 30 minutes for an MRI, now you've got to allow maybe 40 minutes because you've got essential wipe down, cleaning, disinfecting that has to take place between every study. So, the volume is going to be impacted as we all start ramping up, and I think that's going to remain. You're just not going to be able to have the throughput because of the additional disinfectant requirements that are in place now, at least for us as an outpatient provider. But you think of all the touch points of a patient coming into a space that, you've got to spend time, talent, and energy to ensure that that room is clean and ready for the next patient. I will share an anecdote that came in from a patient that came into one of our facilities and actually reached out to us and gave us encouraging feedback, which was they actually had recognized and witnessed. So to the question that was asked, do we think patients are concerned about it? I think they will become concerned about it as they understand what the new norm is. And if they go into a facility where someone's not taking the safety precautions to ensure a safe environment, and you're in a waiting room and, you've got a chair right next to you and not 6 feet apart, it won't take long for the public to recognize what a safe environment looks like post-COVID and what cleaning and disinfectant procedures, you should see it, you should smell it. And I think that the public will pick up pretty quickly on that. And I think social media will blow up if you've got facilities who aren't complying.
Yeah, that's
Right.
a good point. And then it also kind of leads into the next question is, how are you guys going to prepare for when this happens again for the next flu season? With the cleaning, the extra, patients come in, they come out, you got to be able to be extra, have the cleanliness, even more than it's already been. And how do you think that's going to affect patient load in the future? Everyone's scared to go to the doctors. Everyone's scared.
Well, I got to tell you, from a legislative perspective, many of the conversations we're having are with state legislators and trying to get the states to understand that it's great if CMS comes out and says for Medicare patients that you don't need pre-authorizations. Okay, that's like maybe 20% of your volume. But what about the insurance companies that have Medicare Advantage products going forward in the future? Are they going to comply with the CMS recommendation not to have an authorization? Are you going to have insurance companies that are going to look at not post-recovery, but the recovery period that says you've got 2 months of demand where you're going to have a bolus of patients standing by waiting? So as I look to the future and what's going to take place to be able to respond in a more rapid fashion, but also legislatively get legislation passed that says, if CMS says XYZ, our insurance companies are going to follow that. That's not a choice, right? And depending on what state you're in, you also run into the legislative issues of, okay, if only 30% of your patients are in fully insured plans, that means 70% of them are under the self-insured umbrella. So a lot of the legislation that's passed, the COVID, no co-pays, lots of great things being done, but going forward without legislation in place that says if this were to happen again, everybody's covered, right? Because today, not everybody's covered. If you're in a self-insured plan, that's up to the employer. If you're in an ERISA plan, if you're in a labor union, they can dictate whether or not they want to waive co-pays. They can dictate whether or not they want to do pre-authorizations. That's not the insurance company. So, for our markets, 6 to 7 out of every 10 patients are in a self-insured product anymore. So for me going forward, my responsibility with, what RadNet does as the leading outpatient radiology provider, it's what are we going to do to push the envelope on the legislative side to have better mechanisms in place should this happen again? I think the rest of the equation is a pretty easy one, right? I mean, if you haven't learned that, you're going to do the workforce adjustments, have more people working from home, better, safety precautions, waiting rooms, virtual waiting rooms, leverage technology, all of those things I just take as, yeah, that's a given. They're lessons learned that you're going to have in place going forward. But the big unknown for me is how do you get the states how do you get the insurance companies and how do you get CMS to have one consolidated policy that's going to reach every beneficiary and patient that's out there for coverage? Because it's a broken path right now.
Yeah, I totally agree. I think that's one of the challenges we have right now is that it's great that they've recognized the need for COVID testing. They've increased the reimbursement, which was necessary because it was really poorly priced initially. But you're exactly right. The good news that, deductibles, copays, none of this stuff applies. It's all covered, does not apply to everyone. And we are having extreme challenges getting paid on this. And so it is a big deal. And it's hard because then when you flip something to the patient, obviously they're going to be very concerned and asking, okay, wait a minute, all I see in the news is this is a covered test. What's going on? And it's not a one size fits all. So you're right on target there. The other thing I would mention too, as far as like turnaround times and everything, I think that, the initial recovery is going to be a little bit challenging because every business seems to react to the slowdown a little bit later, which means the ramp up's going to come later than it should be. They'll be getting more business than they should, and they won't have enough employees, which is going to affect turnaround and service. And the other factor that's going to be really unique to our situations is anyone that comes in that's an employee. Think about how many employees have worked sick in the history of everything we do. People tough it out. They come in, they give you what you need from them as an employee, and they work when they're sick. Those days are in the past. When you have people that are showing symptoms that could be associated with COVID-19, you can't take a chance anymore. They can't work through the sickness. They got to go home. And so even if it's not COVID-19, if it's any symptom that's close, until we have full antibody testing and you've got clearance from everyone, we're going to be stuck in a predicament where somebody's got some symptoms, they're going home. And when do they come back? When it's cleared or until they've had a negative test, potentially. So that provides challenges for employers too, for staffing, for service, for everything.
Yeah, Wes, I think
to that. Go ahead, Charlie.
I'm sorry, Wes. I'm not sure with the diagnostic lab market, but radiology, 20% of everything we do requires an authorization, MR, CT, PET scans, et cetera. What I think that a lot of the radiology benefit management companies and the insurance companies have to realize is there's going to be a bolus. There's going to be, the RBMs are going to be inundated with everyone catching up from the fact that they've gone 2 months without having these procedures done. Now, during COVID, a lot of the authorization companies haven't had a problem. Most of them have a pretty substantial work from home workforce to start with. Volumes are down significantly, so they're good to go, right? But what happens, and again, planning for the future, when you start having the data come back in on what does recovery look like and how do you anticipate that going forward for another COVID-19 or another pandemic? And I think many of the partners within our industry of healthcare are going to have to put policies in place and or technology in place that's going to help manage that. And for a lot of the authorization requirements, I don't think those companies are going to staff up, right, to catch up. So you're going to have a lot of patients waiting beyond what most of us consider to be a reasonable amount of time to get an appointment. If anything that requires an authorization, elective surgeries, radiology, there may be diagnostic lab procedures that require an auth. All of that has to be looked at so that during the ramp-up period, you don't end up delaying care even further than what it's been delayed. And again, unfortunately, that's a heavy lift, right? I mean, that's a legislative, that's a policy. That's getting a lot of people above our pay grade involved.
To that extent, and it's from the payer side, not so much on the patient access side, but shifting more towards reimbursement. Have you seen any of the payers start to work with you or within the markets on, getting claims paid faster? And the reason I asked that question is because the Wall Street Journal had an article out a couple weeks ago, whereas United Health Group came out and said, we're going to expedite claim processing and payment, which my first thought was, well, if you can do that now, why couldn't you have done that before? But that's a different question. Have you seen any of the payers assist in processing old AR claims or processing claims quicker?
I don't have any data that supports that. I can just tell you, based on conversations I've had with the payers, that they've all been willing to try and help, whether it's advanced payments, whether it's quicker turn times on claims. I mean, think about it. If the volume's down 75%, how hard is it to get a claim out the door quickly, right? I mean, that was good marketing by Optum and United Healthcare Group. But what I have noticed is it sure has been a lot easier for me to get to the right people much faster, to have the conversations about, well, what are you doing? What economic relief do you have? What are you doing about prior authorization? What other programs do you have in place? Did your Medicare Advantage product follow suit and relieve sequestration? So my biggest data point without hard data is just the frequency has been much easier to get a response from those C-suite contacts that I work with. And they're definitely quicker in having the conversation. It may not be the answer we want, but at least they're having the conversation with us and they are responding, which I think is very encouraging. And, you know, for those insurance companies to recognize that, I think they see the strain that the providers are under. And I think they've stepped up and at least have had those conversations with us.
Yeah, on the lab side, I can just say that I'm not aware of any more expedited payments from private insurance, only Medicare. And but hopefully, I just hope in the lab industry we've kind of felt it's been a challenge with private insurance. And the only, you know, if you're going to look for positives in this pandemic, hopefully one is that, you know, all laboratories are more appreciated and understood to have a benefit to the system, as opposed to singular laboratories, capitated agreements, or situations like that. Because when these things occur, you can't rely on one not to service all your members if everybody needs it at once. And so hopefully we see some changes there, but I'm not aware of anything other than the Medicare advancements currently.
Yeah, if there's one thing that this has brought, and we have a partnership with a company called Zyphon, who has a pretty good footprint within the lab market. If there's one thing that this has brought to the attention of the American people, it should be how vital diagnostics are. In the government, and that's both on radiology and lab. And as you guys well know better than I do, but PAMA really took a hit for labs, and you've seen the reimbursement just get pounded year over year. And, you know, diagnostics is an extremely strategic part of the clinical pathway. And if this doesn't raise people's eyes, I don't know what will.
Well, I agree with that. And I also emphasize it's the outpatient diagnostic operations, right? I mean, again, having like 100 locations in New York, to be on daily calls with our teams and to hear the stories and the hospitals. And, you know, it's one thing to hear it on news. It's another thing to hear it from people that, you know, are actually living in the city. To me, that's the takeaway. And, you know, we've had that conversation with our insurance partners about, yeah, maybe you will think twice about what a great partner we are right now, because the last place you want everybody going is to a hospital. For a lot of reasons. I mean, it costs more, and just the safety, and oh, by the way, that they're taxed too, right? I mean, their staffs are cut. Everybody's under different strains. Their revenue streams are impacted. They're not doing elective surgeries. So at the end of the day, I do hope that a lot of our partners walk away and really do appreciate and see the value of those diagnostic practices that were sustainable throughout this COVID. I mean, there are a lot of people that close shop. Just put that in perspective. If you've got labs and outpatient radiology facilities that have to shut down because they don't have the infrastructure to remain open, what happens then? I mean, that's not a pretty picture for access, right? And then you're really overburdening the hospital system. So I share in your hope. We'll see. Wes, what do you think? I mean,
no, I totally agree. I mean, and for us, it's always on the outreach side in laboratory medicine. You've got, obviously the two biggest labs in LabCorp and Quest, and oftentimes those are the go-tos for insurance companies. But when you have a pandemic like this and you have extreme need, they can't handle that all as well. There are necessary additional partners, and you're right. A lot of these reductions in reimbursements have forced small independent labs out of business. Yet in times like these, those small independent labs could be contributors to the solution too. And so it's time to rethink that, laboratory medicine is not a commodity, it's a service. And it's not something for the lowest price that you can find. There's a value to it, and it needs to be appreciated for what it is, and or otherwise it's an impossibility to have everyone step up when it's in need like this.
Yeah, well said, Wes. I couldn't agree more on the commodity, and we love it when we're called vendors, right? It's like, no, right. I'm pretty sure those guys are pretty expensive providers, and I don't think you should probably tell them they're vendors. I mean, it's like, yep. They're an important piece of the, especially population health. We like to say radiology is the gateway to population health, because if you are doing your screenings and you are doing the wellness visits, you're going to save the healthcare industry a lot of money by identifying early on and detecting cancers, et cetera. So we can all just hope, right, Wes, that someone's actually going to have a positive takeaway from this and realize what great people we are.
Yeah, that's the line.
And stop cutting our rates.
That's right.
Okay, David, do you have any other questions? If not, we can open it up to the attendees if there's any questions.
I don't.
Okay. So I don't see anything coming in, but if there's anything else that, Wes or Charlie, you want to add to this?
No, I'll just close with, we all have a responsibility to ensure that we continue to capitalize on the lessons learned. We continue to identify strategic paths that will lead to legislation that will provide continuity in care, not what I consider to be a pretty broken system right now because of the various different government plans, commercial plans, private payers, et cetera, that we discussed. And then going forward, ensuring that whatever outpatient provider you are in, what service you're in, to ensure that you are communicating and demonstrating to your referring providers and, most importantly, your employees and patients, that we have learned there are a lot of good things that are going to be put into place post-COVID, and demonstrate the care and compassion that we have for ensuring a really safe, clean environment for people to be, wanting to come to us.
Yeah, I totally agree. I think that changes will be made, but what we've learned through this process cannot be quickly forgotten. We can't return to the norm in certain circumstances, or again, we will be faced in a situation where we are unable to react appropriately. And so, what's interesting is, we do have a lot of cases of COVID, but we've got probably a lot fewer deaths in percentage. We've got a great healthcare system, but it's been badly damaged over the last many years. And we got to think about that and try and rectify that, because otherwise we will continue to be less prepared when these circumstances arise. But as far as companies, I think the companies are going to make the appropriate adjustments to provide safe environments for patients so that they can get appropriate service.
Thank you. Actually, we just did get a question, and I think we already answered this earlier, but the question was, how are you preparing for the anticipated second wave of the virus in the fall? So I think we brought that up. Charlie made some good points on legislation, obviously the work staff that you have, the cleanliness, sanitation. Is there anything else you want to add to that?
No, I would just reinforce, whether it's a second wave of COVID, or to Wes's point earlier, whether it's any other pandemic and or just, not making this light, but let's say it's another flu season. I think the expectation is we will ensure that we are taking much more seriously precautionary measures. The point about the employees, I mean, yeah, if you're sick, it's easy to say stay at home, but I think it will become policy for a lot of companies to ensure that you've got that safe environment, not just for your employees, but of course for the patients. So whether it's a second wave or whether it's just leveraging everything that we've learned about providing that environment, we talk about the patients a lot today, but remember, those employees are coming into that environment too, and keeping those employees safe. So whether it's COVID or not, I think we're just going to have a much safer environment, and the public's going to expect and have higher expectations of what a clean environment looks like.
Yeah, and I will just say that on top of that, we as an international company, Sonic Healthcare is an international company. So not only do we look at the fall, we're looking at the Southern Hemisphere now and what's going to be coming from that as seasons change. So we're seeing that coming soon here. We're seeing the fall and looking towards that. And for us, it's increased ability to do testing, serology testing, antibodies. All of those are going to be crucial as we look and hope to have a vaccine or understand what the real solution here is. All of the other things that have been discussed are crucial to the solution, but we're preparing simply to have more capacity. And additionally, I think really the important thing that is an opportunity for people in this country is supply chain. And what goes with supply chain? One of the big problems we've had, collection kits, extraction kits, all the things that are needed in addition to just having the testing kit. So having those available, having industries that can provide those will be crucial as we continue.
Great. So that's, for the sake of time, I want to thank Charlie and Wes for joining us today and everyone who's attended. We hope you'll be able to join our next webinar, which is on Tuesday, May 12th, titled Emerging Video and Imaging Technologies That Will Impact the Future of Telemedicine. So with that, I'm going to say goodbye. Everyone stay healthy, and thank you for joining.
Thanks, Laura.
Thank you very much.
Thank you.
Thanks, Charlie.
Thank you. Bye.
You bet. Pleasure. Bye-bye.